Dr. Chris Visser is a private practitioner with a surgery and waiting room in a city. He runs a mixed practice, but the mornings are spent in treating domestic pets brought in by their owners. People are particularly conscious of a pet's distress and have a high regard for the vet's ability to relieve the suffering. Whatever the problem, help is at hand. The old regulars take things calmly, but the first visit is an anxious time for a young master and his best friend, who won't like the needle.
Now he's going to start lying down. Just give him time. He'll be all right. He's going to go down now. There you are.
This could have been a bite or something done on purpose, you know.
Yeah.
Not too many nasty kids around there.
A good vet is also good with people. Friendly, informative, reassuring.
Mr. De Almeida, we're going to treat it now, give it some injections and keep it here. And we want you to come and fetch him this afternoon between 4 and 7. Because I think he'll be wide awake this afternoon and he can go home, you see. So he doesn't have to stay here overnight. It's better if he goes home. I'd like to see him on Friday again. And a typical day would probably involve 3 or 4 horse calls and perhaps 2 or 3 calls to bovines or cows. And we get the odd sheep call and every now and then a pig that comes in.
With a mixed practice, a vet is frequently required to visit clients some distance out of the city. The health of a working animal is of constant concern, as it has to be fit to earn its keep. Loss of condition could be due to a minor ailment or upset, from which the horse might recover on its own with rest and attention. But it could also signal the presence of an infectious disease that endangers the whole stable.
Yeah, but it won't be horse sickness.
No.
In addition to an on-the-spot diagnosis and treatment, the vet will usually take specimens and samples for later examination, either by himself or by the Veterinary Research Institute at Onderstepoort. He carries an extensive range of drugs, medicines, and vaccines to treat the various cases among the wide variety of animals he will examine on his rounds. He has a sure knowledge of each bottle's contents, the correct dosage, the method of administration, and the curative effect. Experience helps him to decide instantly on the best medication. But he has to familiarize himself from time to time with new preparations and their usage. A city vet with a country practice needs more functional attire than the traditional white coat. After a quick change at the surgery, Dr. Visser is ready to handle a large animal which he knows will not be as cooperative as his last patient.
I find that working on the farms, you always have help available and cooperation from the farmers, and you see the animals in their natural environment. However, for small animals, we prefer not to make calls because of the fact that we've got all the different medicines and equipment that we use when we treat them at our own surgery. Hello, Visser.
It's all in a day's work.
Yes.
But back at the surgery, an emergency call lengthens the day by several hours.
My day finishes around about 4 o'clock when I come back to the surgery. When the small animals start coming in, we consult from about 4 till 7. And often at night there's a call, either a horse with colic or perhaps a cow that cannot calf, which are the usual cases that we find. If he wants to roll, then rather walk him around. But if he seems quiet, just keep him in one spot and don't try and feed him or give him any water or anything like that to drink. and I'll be there as soon as I can. How are you?
Very well, thank you. Chrissy seems to have colic.
Okay, we'll have a look and see.
Thank you.
Why do you say that? What has he been doing?
Restless, he was lying down trying to roll, and it seems to happen about every half hour.
I see. Did you change the food or anything like that?
Chris, we didn't change it, but we got a new load in about a week ago.
Well, I think his tummy sounds fine. It's probably a spasmodic colic. I don't think it's an infection because you can hear all the different rumblings. The color is not bad. The heartbeat is more or less normal. So I think our problem here is perhaps a spasmodic colic, probably due to something he's eaten.
Yes.
I'm going to give him an injection now, and then we'll decide after that if we think it's necessary to tube him or not. But I definitely do want to give him an injection.
Yes.
Perhaps tomorrow will be an ordinary working day and end at 5 or 6 o'clock. It all depends on the needs of the animals. A vet accepts this and manages to keep enjoying his work. For the satisfaction of a meaningful job, well done, makes up for the inconveniences.
Okay, Phil, yeah, I think that just about ties it up. If there are any problems, please phone me. I don't think there should be any problems, but let me know tomorrow morning. I'd like to know in any case. Okay, good night.
Thank you.